Assalamu alaikum. I'm Sabahat Latifi, and I'm a clinical therapist here at Khalil Center, Chicago. And today I'm going to talk about active suicidal ideation. This means when someone expresses a plan, means, and intent to suicide. Suicide is a really scary topic to talk about. Even just saying the word suicide is anxiety-provoking and difficult. There's usually a lot of shame, guilt, fear, and hopelessness surrounding this topic. While there is no cookie-cutter way to identify suicidal behavior, here are some common warning signs. Hopelessness, helplessness, and worthlessness. These are usually shown in behaviors such as lack of motivation or sudden lack of hygiene, or saying things like, I'm just done, I'm just exhausted, what's the point, it's all going to end anyway. Extreme behavioral changes are also a common warning sign, such as an extrovert suddenly isolating or withdrawing from family members or loved ones, or giving away possessions and saying goodbyes. While one or two of these may not necessarily mean suicidal ideation, they could be indicative of mental illness and a need for professional care. So what can you do? If someone you love expresses suicidal ideation, you need to have an open and honest conversation with them and get them to emergency care as soon as possible. This means getting them to an ER, a hospital, a clinic, or a crisis unit. If you can't, for whatever reason, have that conversation with them, you need to get them to talk to their loved ones or talk to their loved ones for them, such as a parent, a spouse, a mentor, a sibling, anyone who can have that conversation with them and get them to the emergency care that they need. Even getting them to a therapist is great because the therapist can guide them towards next steps of care. Do not stay silent. Always speak up. It's a difficult and uncomfortable conversation to have, but speaking up is always better. When responding to suicidal ideation, keep your personal beliefs and reactions out of the conversation. When someone expresses suicidal ideation, reason and logic are not the goal. The goal is to get them the professional care that they need so they could start to reject suicide and accept life. For more information and further educational services, look us up in and around Chicago, the Bay Area or NYC, or online at KhalilCenter.com.